sports injuries, basically two joints are more commonly injured. One is the shoulder joint and second is the knee. Knee being most common. So again, in knee, as I mentioned earlier, ligamentous injury is what happens to sportsmen. So in football, ACL and meniscus injuries are very common. In cricketers, shoulder injuries are very common. As you know, Sachin Tendulkar, you must have heard that he has gotten so many shoulder surgeries done. So that is there. Shoulder and knee are more common. But yeah, in cricket, there is also spinal injuries. But they are not related exactly to sports. Sports basically covers knee, shoulder, ankle, and hip joint. So in shoulder joint, there is supraspinatus tear, which is a ligamentous tear again, where the patient gets the shoulder dislocated again and again. Again, Rohit Sharma as an example, he relocates his shoulder in the middle of the match. So yes, shoulder injuries are very common, but knee injuries are common. So the injury, basically, we can divide the injuries into sprain and tear. Okay. Sprain or tear. So tear can be partial tear can be a complete tear. We are talking about ligaments here. So if the ligament has a partial tear, we can advise conservative management for that. So you can put it into the box of not so serious. But if the injury is complete, if the tear is complete, then yes, you have to put it in the box where surgery is required. So yes, it is serious, but it's not a life-threatening injury. So it's not serious, but it needs some intervention, some external intervention. So yeah, and sprain resolves by itself. So in ACL, you get sprain, you get partial tear, you get complete tear. Okay. So in sprain, nothing needs to be done. Just few supplements to decrease the inflammation, decrease the swelling, and the player is ready to go. In partial tear, the player needs a good conservative management of physiotherapy protocol needs to be followed for like 2 to 3 months. If there is a complete tear of ACL, then yes, surgery is required and arthroscopic surgery is required. Then we put graft instead of ACL. And then yes, after good physiotherapy of like 6 to 8 months, player is ready to perform again. So arthroscopic surgery basically is, as I explained in TKR, so in TKR we need to put big incision of like 10 to 15 centimeters over the knee joint and then we operate, right? Because we need to put bigger implants. But what arthroscopy means, arthro means joint, scopy means a scope, which is a pencil-like structure, which has a camera at the end of the tip. So what happens is, so it's very thin structure, so maybe like thinner than my little finger as well. Okay, so if this is knee joint, we take 1 centimeter incision on either side, and the scope is inserted into the joint. Okay, the scope is inserted inside the joint, and then through the camera on a TV screen, we can see the whole joint. So with that incision, we can also operate. So these ligamentous injuries can be operated arthroscopically. So there is not much incision, there is minimal blood, minimal bleeding obviously, and recovery time is definitely better and faster. As in indications. So in indications is when patient has, so let's just talk about knee because it's very vast. So we'll talk about knee. So in knee, if there is an ACL injury or a meniscus injury. So if there is a meniscus injury and if the patient is having clinical symptoms, like if the patient is having catching or locking sensations, if the patient is having a lot of pain, then we get an MRI done. On MRI, we can see if there is an injury or not. And if needed, we do operate. So any repair or any reconstruction of the ligament is being done by arthroscopy. The same goes with shoulder. In shoulder, the patient who dislocates the shoulder very often, we need to repair the capsule. So that is done arthroscopy. So anything related to ligament or meniscus can be treated by arthroscopy. So basically, these injuries are situated inside the joint. Okay, so again, I will bring my model over here. So if the injury is inside the joint, in this portion, so this is the meniscus, and how much you can see inside there is one structure which represents ACL. Okay, so this if there is tear on the ACL or any meniscus which is inside the joint, can be treated with arthroscopy. The same goes with shoulder. Whatever pathology lies within the joint can be seen with an arthroscope and operated. Okay, but if there is an extra articular pathology, if for example, if there is a fracture over here on the bone, obviously we can't go inside the joint and take a look over here. We can't see that. So any pathology which is inside the joint can be operated. Whatever there is outside the joint can't be operated. Painful, yes, again subjective, but much less than TKR because incision is very small. So the pain might be, for example, if in TKR, if I say the pain from 1 to 10 range, if pain is 8 to 9 in TKR, in arthroscopic surgeries, it is 2 to 3. So it is as good as no pain. And we don't need many modalities to control pain. Only injectable painkillers for like 1-2 days is enough for that. And patient is good too. So as I said, arthro means joint. Scopy is a scope, an instrument. The same goes with laparoscopy. So lapar means abdominal region. And scope means again the scope, the instrument. So arthroscopy is whatever if you are dealing with a minimally invasive procedure around the knee joint, around the shoulder joint, or around any joint, is an arthroscopic procedure. But if you do it in the abdomen, then it becomes laparoscopic procedure. The basic difference is the region where you are operating it. Joint is arthroscope, abdomen is laparoscope.